Catherine Lutz. I'm an anthropologist at Brown University, and I've been studying Americans and their cars for the last several years and have a book on the subject, and I'm going to give you some data from that, from our findings there on the car system and some of its effects on our well-being. What I want to first do is just describe the scale of this car system that we have. I think the word for it is ginormous. We have 250 million cars and light trucks on the road in the U.S. Obviously, Rhode Island, some portion of that. 91% of households own a vehicle, 2 per household usually. There's, again, a gigantic stream of car sales every day. Many miles driven annually, and those numbers have doubled in just the last several decades. So Americans are not just owning more cars, but driving more. And spending a tremendous amount of time in their cars. 18 and a half hours is the national average as a driver or passenger. Rhode Island, I think, would have slightly slower numbers. Some of the sprawling states have account for the higher numbers there. And I think, again, it's the result of a massive government policy preference for the car over other modes of transit that we have such a car-dependent system. And it has a tremendous effect on everybody's health. The main points I want to make is that it produces, as we all know, a tremendous amount of air pollution and the health effects of that. It's important to be reminded of that. That car crashes remain the leading cause of death of young people in Rhode Island and around the country. That the costs economically for every state are very high when you add in the congestion, the cost of congestion on local business costs, the cost of crashes, medical and other costs. Road maintenance, and of course, is a major burden on local budgets. We have also the problem that car ownership presents a tremendous burden on individual households. This has sort of been outsourced to households to get themselves around in a way that I don't think we recognize what that entails for the individual family. And I'll talk a little bit about that. And in addition, I think we can argue that car-dependent economies and car-dependent states are going to be more unequal than states that have a more mixed transit profile. And they're also less robust. We can find data to show that cities and communities that are more car-dependent have also responded very much less well to the economic recession in a variety of ways, including with housing prices. So basically, again, the health effects are well known. They're well demonstrated. If half of all air pollution comes from cars, which it does, then we have to account for half of the 70,000 deaths each year as car-related deaths. These are the 70,000 deaths as a result of air pollution's cancer rates, asthma, increased asthma rates, increased stroke and heart disease rates. Many car interiors are also off-gassing materials that are harmful. We have also the car as a major contributor to the obesity crisis. Just in terms of looking at your local health care costs, epidemiologists have identified something called the public transit diet, which is the 5 to 8 pounds on average that people lose when they move from car use, predominant car use, to transit use. So that's been demonstrated even more so, of course, if you walk or bike. The car-dependent system is also especially hard on the health of people who live near highways. They're what our epidemiologists have identified as cancer corridors. So again, looking at for public health involves asking, who's bearing a lot of these costs. And so it's particularly hard on the poor who tend to be in those corridors, high traffic corridors, and on children who have been shown to have diminished lung capacity when they grow up in smoggy environments. We also have the reality that the car crash is the leading cause of death of Americans between the ages of 3 and 34. That's a pretty stunning statistic. I think it's true as well in Rhode Island. We have cases all the time, as we know, where, again, not just young people, but often young people have more years taken off their lives through car crashes than anything else. These are again, among the 40,000 fatalities that have been every year in the United States, that have occurred every year, the number went down. We've had a dramatic drop in the number of fatalities just in the last couple of years as the amount of driving that people have done has dropped as a result of gas prices going up and the recession. So those numbers remain steady for many, many years, even with the enhanced safety equipment in cars, and in good part because we were driving so much more across the country. And again, these are the death rate is really stunning, but the injury rate is also phenomenal. This is a chart that just shows how emergency room docs take in and triage their patients who come out of car crashes. And we find, and across the country, literally millions of people who are injured every year in car crashes. I came to think of this as the hidden nation of the car disabled, and the hidden state in Rhode Island as well of the car disabled is something we need to pay attention to. These are long-term, really significant health costs that are being borne as a result of the car and its likelihood of crashing. And again, the other costs, much less, of course, significant than those human costs and the financial burdens borne by families, are the community, the government burdens of the costs of emergency first responders who are out there every day picking people up off the highway. The annual cost to the nation of crashes is estimated to be $433 billion a year, which is quite phenomenal. And a lot of that is borne by states and localities. One study found that 40% of Denver's police activity and 15% of its fire department deployments were for auto crashes or for auto infractions. So again, there's also the parking and street maintenance, plus the $11 billion that go into local tax bills from lawsuits, judicial actions, and other DUI and other related offenses. But as I mentioned, I think the important thing also to recognize is how much of the expense gets privatized, gets put onto households. So when you look now across the country at the average household budget, transportation, and it's mostly car costs, it is very close to housing as the major cost. It's before food, it's before education, utilities. So again, it's something that we need to pay attention to. In some localities, that number is now larger than the housing number as a proportion of the household budget. Many people focus just on the price of the gas, but there are a huge number of costs which one has to put together to say what are people paying out of pocket every year to drive the number of miles that they drive. One of the reasons the burden on households has increased pretty dramatically is that cars have become much larger and more luxurious. The price has gone up much faster than the rate of inflation. And many people are buying on credit, and again, often almost the full value of the car is being put onto credit, and that is an additional cost, which has also had these economic effects that we really also have to see as a macroeconomic effect, where the average household is putting much more money into a vehicle loan. Here we have what you see here is over just the last 40 years, almost a double the amount of the average loan that's taken out in inflation-controlled dollars. And that's happened at the same time, and not coincidentally, that the personal savings rate has really collapsed in the United States. And so, again, we have to think about household welfare in that way as well. And then finally, in terms of looking at the household budget, it's a very different effect, of course, by class. So the poor spend much more of their transportation budget, spend much more of their budget on transportation. And these are earned dollars, not the entire amount of money available to households. But of those earned dollars, 42% in the lowest fifth of the income distribution goes to transit. Obviously much less as at wealthier groups. And of course, the kinds of predatory lending and predatory practices around the car make our poorer citizens much more vulnerable. This is not a business that's here in Rhode Island, at least so far, but in the Southwest they've got many outlets. They rent tires to often the poor who can't afford even the $400 or $500 for a set of four, and they will actually get you to have paid $2,000 for that set of four tires by the end of the term of this rental term if you don't return them. So one of the other things that a lot of transit activists have begun to look at is where people can find affordable housing and transit together. And suggesting that given how high these transit costs are, this is maybe a complicated map to get right away, but it shows in yellow the parts of the urban New London area which are affordable for most families. And this would be 30% of your income going to housing. If you add in transit costs, however, those number of areas where anybody can live is much smaller. So there are, when you add in how much people have to pay to get around, you find that, again, it should be less than 45% to be sustainable. And most people in a lot of even our northeast areas here, are in a situation where they just can't find a place to live and get to without the help, obviously, of other forms of transit like mass transit. Finally, the question of economic development. We know that families in sprawled out communities like Phoenix and Atlanta are spending $1,300 more a year than families in other communities getting around. So that's just a very significant thing. Now, we would say in Rhode Island we don't have quite the same problem, but we still, again, have people at some level of that impact of that phenomenon. We see that a study has done comparing Detroit and Toronto on their government policies on transit, and Detroit they spend very different amounts on transit. Detroit spends twice as much on roads. Toronto spends much more on transit, and they have a much more vibrant and sustainable set of data on their economy. So more sprawled out and car-dependent communities are also more vulnerable to the burst housing bubble and to gas price shocks. So this is something, again, for the long term that we have to also recognize that Rhode Island's in the same kind of situation. That the more that we're sprawled and the more that we don't have transit to get around, the more likely people are to experience this in the future. Local businesses also, of course, have to deal with the price effects of congestion, worker immobility, and the local tax rate, given, again, how much is being spent to support roads and bridges, which obviously need maintenance, but the whole question of what's a more economically viable long-term solution is, there's data available to suggest that transit has got to be supported as a matter of public policy in order to have long-term economic health of a community. So I will stop there and look forward to questions.
Thank you, Dr. Lutz. What I'm hoping to do is have, if there's clarifying questions, feel free to jump in, but let's at least wait until we'll go in pairs of the speakers, but I was thinking about going till the end, but I think we're going to want to get our feet wet with that. So now we have Director Michael Lewis, Department of Transportation, going to talk a little bit about some of the Rhode Island situation with our transportation system as well.
Great.